Hi, everyone. Welcome to Bringing Virtual Care Home. My name's Tina Null. I'm the Chief Clinical Officer at Anelto. And today my guest is Nicole Bradberry, who's the CEO and founder of the Florida Association of Accountable Care Organizations. Welcome, Nicole. Thank you for being my guest.
Sure. Thanks for having me.
Sure. Hey, let's start out today by having you tell the audience a little bit about your background and what inspired you to bring your talents and experience into the healthcare space.
Well, I've been in healthcare for way longer than I'd like to tell you. Um, I started on the payer side. I was there probably 16 years on the payer side. Last um, bit of that with United Healthcare. And I think what I did at United kind of spurred what we now call value-based healthcare. We were really looking at how to move the needle on cost and quality within a large payer. Learned what worked, learned what didn't work. And so those things that didn't work spurred us to go outside, do a startup back in 2009, which was really about how do we wrap programs that drive cost and quality around doctors, who is the trusted advisor, and really, which is the definition of value-based healthcare, right? Moving risk from insurance companies to providers and letting them partake in it. And so did that with Rise Health. That's company ended up selling to Best Doctors and Teladoc eventually. And then I started another company called Orange Health right about the time the Affordable Care Act came along with this ACO Medicare Shared Savings Program model. And so started a company to really be an ACO enablement company, kind of a predecessor to what we now think of as Alidate and Signify and some of those big entities doing it today. And at that time, I looked around at the marketplace and said, this is kind of the wild, wild west in this accountable care, value-based healthcare, chase. And so I formed the Florida Association of ACOs at that time, really just kind of to harness that marketplace and bring everybody together so we could learn from each other, network, and really, together take this journey for value-based healthcare.
Well, that is wonderful. So, what are the primary goals of the Florida's Association of Accountable Care Organizations?
Well, it's like I said, it's really just to bring everybody together who's trying to play a part in value-based healthcare. Florida was a very unique market. It was led by independent entrepreneurial docs versus a lot of hospital-led markets, and it's probably the reason it's the most successful value-based healthcare market in the country. We were out of the gate first. We have two of the most successful ACOs in the country, Millennium and Palm Beach ACO. And so it was just, a good marketplace to bring all those thought leaders and innovators and entrepreneurs together. And that was really what the Florida Association was about. It was, how do we bring everybody doing value-based healthcare together so that we can learn from each other and get better and move the needle to that kind of financial model.
So then what type of health entities joined the association, and how does the association help them with meeting their goals?
Well, so initially it was all about Medicare. It was the Medicare Shared Savings Program that came out from the Affordable Care Act. And so, my entire board was made up of leaders running these big Medicare ACOs. But since, that was kind of the original makeup of the association, but now it's commercial ACOs, it's Medicare Advantage, it's anybody really on this path of value-based healthcare. So, we have education, we have a big conference every year, we have business partners and we promote them to our members. I mean, we do a lot of stuff along those lines, basic association stuff.
Okay, so you're kind of the conduit to bring all of the thought leaders in this accountable care space together to kind of up everybody's game in that particular area. Okay, great. Well, um, the healthcare leaders and the organizations that comprise your organization, how do they work together to increase the quality of care delivered to patients?
Well, so that is the definition of an accountable care organization, is really how do you use data? How do you bring new tools to the table? How do you really, educate and create change management within practices in order for them to think longitudinally about the patient, not just what the patient's dealing with today. And so, the ACOs kind of wrap all those things around doctors to create high performance and better outcomes for patients. I mean, truly that's what their purpose is.
So, in what type of specialties do you feel like the ACO has made great strides?
Well, the ACO is really focused on primary care. It's like how do we support primary care to look at a patient population holistically and manage their care across the continuum, and certainly within that spend that primary care can influence. Cardiac and ortho probably are the two top spend components from a diagnosis perspective, and then where all the money is to hopefully save and shave and keep people happy and healthy at home is in the hospital. So, you don't want people going to the hospital. You want them healthy and out of the hospital. And if you can accomplish that by really managing from a primary care perspective, then you've accomplished the goal.
Great. Well, so how has the organization created strategies to overcome barriers that have been defined by social determinants of health, access, and everything from access to um, technology deficits?
Well, I mean, initially there was so much low hanging fruit. It was really just about organizing and looking at the patient's data, trying to make sure we got patients in front of the doctors at the right cadence, assuming the doctors would do the right thing. In order to do that, we had to bring technology to the table. We had to bring analytics to the table. We brought new tools. We educated. I mean, social determinants are just kind of the latest buzzword, but as we're trying to engage and move the needle with patients, if we don't understand what else is going on in their life that affects their health care, then we're not going to be successful in engaging. And so how do we get smarter about what else is going on in their lives and employing that as we outreach? And so, all of that comes together in order to create better outcomes.
And so, have you looked at using virtual care as a modality for furthering the objective of the um, improvement in um, outcomes?
Sure. And I'll tell you, COVID came, everybody was looking at telehealth and how do we deploy it. There was some barriers there with payers paying for telehealth, but, under risk contracts, it made sense to kind of move ahead even, outside of some of those um, issues, around deploying it. But when COVID came, wow, that just ripped the Band-Aid off of it. And telehealth became, one of the ways that we kept in touch with our patients and seeing them when everybody was locked in and hospitals weren't accepting other than very critically ill patients. And so it really did prove that virtual care is the model of the future. And I don't think we'll ever put that genie back in the box or the bottle.
Yeah, I'm glad to hear you say that because I believe the same. So, what would you like to, or how and why do you envision value based care becoming the future of healthcare as a national model?
Well, it's already heading down that path. I mean, it's probably, us, those of us who kind of been in it from the very beginning thought it was going to be a much um, faster pace for implementation. You've got a lot of disincentives and blockers in the world and in the nation that have slowed down that path, but it's definitely heading that way. There's very few doctors that aren't doing some kind of value-based healthcare. Certainly Medicare led the charge. Commercial payers are signing, getting on board and have all kinds of contracts out there for providers to participate in. So I just think it's just a matter of time before everybody in the world that's practicing medicine is part of kind of these new payment models that incent the right behaviors.
Yeah. So, what do you think is the primary blocker to people moving in this direction and away from what we traditionally knew as fee for service?
Well, I mean, I think it's just hard. The change is hard, but when you've got one of the largest industries in the country, that is supports itself from a certain financial model, it's hard to change that. You've got to change technology, you've got to change people and processes, and you've got to change. You've got to move models that reward certain folks in the system and move it to other folks. For example, is probably 80% of the pie has gone to hospitals historically, and we want to move a bunch of that pie to primary care and to specialists who are really going to keep people healthier. Long term, I think it's changing the standard of care from test and prescribe, test and operate to really kind of root cause healthcare. And that's a huge shift. And a lot of people, that are making lots of money today are going to be left out of that shift. And so, changing that is going to be difficult, but it's the right thing to do. So, you just got to keep at it.
Yeah, I 100% agree with you. I spent a lot of my career in health systems. At the front door was acute care. And we know that that cost over time will bankrupt our country. But in the meantime, changing the foundational thinking and structures that have supported healthcare for so long is a mammoth task. So I 100% agree with you. Um, so, what's next for your organization?
Well, this is our 10th year in existence, and we've got a big conference planned. It's going to be a lot of fun. So I would say anybody listening who is interested in learning more about value-based healthcare and getting engaged, come to the conference, and that's in October. And you can check us out on our website, FLAACOs.com. But you know, it's. I think behavioral health is a big topic. I think getting more specialists into the game of value-based healthcare is a big topic this year. Health equity is certainly on the radar, along with social determinants of health. How do we incorporate that in all of our engagement? You know, there's always new things that come. ACO REACH is the new Medicare model, and so you know, to see if that's going to last and compete in a big way with MA. I think all of those things are things for us to watch out for.
Yeah, I did take a look at your conference from last year in October. I think it's safe to assume that the conference site will be somewhere in Florida. Is that true?
Well, typically we always do it in Orlando, and this year it's already at the same place as last year, the Hilton, and it's a great venue. And we've got some fun things planned since it's our 10th year, so it should be a good event.
Looked like you had a really rich cast of speakers and topics. And so, yeah, sounds like a great conference. Is it the same? You said October of 2023. Do you have the dates of that?
No, I don't have them handy, but if you go out to the website, I should know them. You can see the dates there. I think it's maybe third week in October.
Okay. And did you have people across the nation come to listen in?
Yeah, we do. Every year we get more and more people outside the state of Florida. I mean, Florida is the number one market, and so lots of people want to come and learn, you know, why we're so successful. And so we not only do we get great keynote speakers that come from, you know, other places than Florida that are doing some really cool things in value-based healthcare. We have people that just want to participate and be part of it. So yeah, we have a quite, and it's a very executive level kind of turnout. It's the folks that are really driving change, innovating, entrepreneurs. That kind of audience, or you know, participation is what you see there.
Well, that's great to come to a conference and be able to take something home that can really help to change your direction for something more positive is wonderful.
Yeah.
Well, do you have any closing comments you'd like to leave with the audience before we end our session today?
No, just thank you for having me, and it's always exciting to talk about value-based healthcare. I think it is the way of the future, and so you know, whenever I can help be a cheerleader for it, I'm willing. So thank you for having me.
Yeah, thank you again for being my guest. And for all of you out there, I hope you'll join us again soon for another episode of Bringing Virtual Care Home. Have a great day.